Okay, so in this next part of live discussion, I shall ask our dear Ilter his experience about the approach that he has made with the muscular vectors. Please, Ilter.
Thank you, Eugenia. That's a great opportunity for all of us. Well, in my idea, we need to have a deep understanding when a singer comes to us for a solution. But to understand the problem, you know the word, you need to have your ears before the computers. The clinician's ears are so important, and our ears should be combined with physical medical knowledge to create a treatment, because diagnosis is for treatment. I mean, diagnosis itself, single diagnosis does not mean anything if there is no treatment. So diagnosis will show us how the treatment will be applied. So that's why I insisted, or I tried to explain the glottis, the vector composition of the glottis. It is a 3D dynamic space. You know, the glottis is not tissue. It is a space, and this space shows how the spectral density will happen when the energy transformation from the subglottic pressure to acoustics. So it is so interesting for me, and I have to admit that every patient comes to me when I try to make this vector analysis. It's like playing chess. It's fun. So you enjoy it also.
Thank you very much, Ilter. Filipa wants to ask something. Yes, please, Filipa. Filipa. I am sorry, I think. Filipa? Yes, okay. You're there. Yes, Filipa.
Yes, sorry, I had to.
Yes, okay, Filipa.
Nature was calling me. A question to you, Eugenia. Thank you for your presentation. I would like to know how many times you would recommend a singer who has sinusitis and rhinitis, if you would recommend the nose wash with warm water with salt, so salty warm water, to prevent sinus infections and negative impacts on the quality of the voice.
Yes, thank you for your question. I think this is very important, that the nose has to be clean, mainly from the phlegm during the morning, but also before rehearsal and before a presentation. That doesn't mean it has to be washed exactly immediately before the presentation, but let's see 2 hours before that. But it doesn't mean it has to be a rule. It is not necessary for a normal nose to be cleaned in this way. It's mainly when you have a flu or if you have allergies, and that's why we are also recommending not only the rust allergy test and the desensitization treatment, but also to be careful with the atmosphere, for example, with the environment at home, if they can have purifiers. And also another thing that we are doing with this artistic voice professional users, we are doing this diminution, or the making small the inferior turbinate. So for the washes, I think it is important, but it is not a rule. Of course, if you have a chronic sinusitis and you have had no surgery with the big procedure, then you have to be careful with all these washes. And what I do recommend, for example, in the singers and actors that are in a dry atmosphere, is to have also nebulizations. With warm water is enough, because sometimes the nose does not accept so easily the salty water. Sometimes the salty water is making some irritation. For example, in Italy also they have a yellow clean, and the yellow clean in Italy is hyaluronic acid in nebulizations also for the nose, and I think it helps. Personally, I use, because we don't have that in Mexico, we use only the nebulization. We use washes with a small quantity of a natrium bicarbonate, and also with some drops of glycerin. And the wash, we wash the nose, but with pressure, having the ear closed and making like this when you have the inhalation of the water and then the exhalation. And also we have some, as everybody knows, there are many flashes that you can use for cleaning the nose, but it is not a rule. I think the important thing is that the actors, singers do understand what is happening in the nose, and that the examination of the artistic voice has to be the nose, because many of my colleagues, general ENT, well, they think it is not a big problem to have a small degeneration in the inferior turbinate, and it is important for the artistic voice. Thank you, Filipa, for your question.
Yeah, and I also wanted to say that sometimes I lost my voice because of pharyngitis caused by posterior nasal drip that becomes very thick mucus, and then a very nice place for bacteria to develop and all that. So, and I also read, just for a second question, and then I will be silent, that there were studies showing that the risk of being contaminated with COVID was less in people that would wash their noses more often than those who didn't. I would like your expert opinion on that.
Well, to the first situation, I do agree that the post-nasal drip is a big issue for the artistic voice and also for the general voice. So we have to be careful. That's why in the World Voice Day and all the countries that are making so much education of the general population, it's important to see, please take care of the respiratory diseases. No, it is not only a flu, but it's a big problem. And about COVID, I think this is like a fake news, because if you have a proper humidity, if you have a proper function of your cilia in your nose, it is wonderful, but it does not help to avoid coronavirus SARS-CoV-2, because as we know, the proteins that are coming from the coronavirus, they are coming inside because of the ACE, because of the enzymes that allowed the coronavirus to come all over our body. And of course, the first place can be the nose, but also can be the pharynx. So it's a fake news. I don't agree that having a proper nose humidity or washing the nose can, unfortunately, can avoid the coronavirus. What we think now in the 2021 year, after 1.5 years of SARS-CoV-2, we think that if we have a proper nasal breathing at night, and if we have a proper nose function, and if we take care having the mask properly in our face, we are having prevention. But other thing, it doesn't have anything really, unfortunately, to avoid coronavirus. And also, Chris, you wanted to ask something?
Yeah, I have a lot of comments, a lot of questions, but I'm going to wait.
Okay.
That's okay. No problem. You know,
Okay.
it's interesting. I also think that some slides were very difficult to read. They're too small. Some were very readable. Some audio connections were very poor, but that's fine. That's okay.
Yes, I agree completely with you. As you know, well, we have technical problems, and I would like you, if you have more experience, like Sten and perhaps Johan and Ron, perhaps they can give us some advices, because we are organizing for our next September Congress, that we say to the speakers exactly what they need to do in order to have a better sound, a better reading, as you say, and also to have it fluently. I do apologize, but some technicians are not really very easy, because they are also depending on the internet connection that we have at home. So please feel free to give advices to me, to Eugenia Chavez, and this is a great thing. Then we can have it better. But anyway, we are going to put it on the webpage, and we shall try to avoid these sound problems.
I also enjoyed very much very focused subjects. Some subjects were very direct, very focused. Some subjects were very kind of wide. And for 5 minutes presentation, that's very difficult to put in information like that. I really appreciate that this talks were very short. I love short meetings. In my conferences for 29 years, I usually have 5 to 10 minutes maximally, unless there's some kind of something very special that you give to a speaker of some importance, maybe half an hour to give a long talk over a 3-day conference. But congratulations on having this 5 minutes restriction. That's great. Please just keep it very small, very focused on what we're going to do.
Well, thank you, Chris. The idea of this concept was to come inside of the daily practice of each of us. Of course, the speakers were now 11, but in another meetings or sessions, we can have more. And feel free to write to me and propose themes. But I thought it was necessary to have these short videos, because we have had long videos with a very special concept, and also that everybody knows what the others are making or are thinking. It doesn't matter that our recording is not so good. Of course, there are great recordings today and they are not so great, but the idea was to exchange knowledge and to talk to each other as we do now, because it is a great opportunity of these online meetings. And Isabel, you were going to ask something, Isabel Garcia Lopez? Or I ask you? Well, I want to ask you, Isabel, if you don't have any questions. I thought you had questions. I ask you if you have experience about speaking voice, but with different languages. For example, I have experience when I was in Vienna and in Berlin, that came many patients that spoke several languages. And with some languages, the voice was in a better situation, and with other languages, not. For example, Russian, the people who spoke Russian, was not so easy to have a right speaking voice. And some of the French speakers also have some problems with resonance, not because of the language or the accent, but because of the mechanism. I don't know if you have some experience, Isabel.
Yes, I have the same opinion. Yeah, I have seen many times voice professional and singers that say that I think this not happen a lot with the singing voice when they sing, for instance, in German or in other languages different from Spanish. But yes, when they have to speak in English, for instance, Spanish speakers that have to speak in English, that they feel that the position of the voice, of their speaking voice, is clearly different. And sometimes in singers with voice problems, they feel that they cannot put the voice at the same place, at the same position when they speak in other languages. Yes, I have had this experience.
Thank you very much, Isabel. And John Rubin is asking Christoph about his experience, Christoph, with problems in post-COVID or long COVID patients due to lung problems. Yes, John, affecting breath support. If you have this experience, Chris.
Okay, so we have been in California specifically, extremely conservative of seeing COVID-infected patients for any clinical, non-necessary or not primary necessary clinical testing. We do know, however, that the most acute period is at the very beginning, maybe a little bit before even signals that there is a COVID infection, and it goes on for the first maybe 1 to 2 weeks of acute infection. However, follow-up is poor, and we don't have enough data to illustrate behavior in professional voice users, singers, teachers, actors, television, anybody who uses voice professionally. So that is something that we will, if I may say, Eugenia, that we will be discussing in our 28th annual Pacific Voice Conference, which we do together with you. And I was looking at so many months ahead that you have already arranged for different meetings, but we'll continue, and we'll have some sessions regarding to COVID as well. With regard, if I may maybe say, I don't know, John, if you are satisfied with my answer or not, but I am not clear if this is exactly what you wanted to know.
Chris, thank you. Thank you for your presentation. I enjoyed it very much. It's a really interesting problem, this whole question about ENT manifestations and quote unquote long COVID. And I personally have yet to see patients with long COVID involving ear, nose, and throat, and I haven't seen any amongst singers. The main thing that we've seen in my trust has been people who've developed subglottic stenosis subsequent to tracheostomies or prolonged intubation. We've seen a lot of that, but I haven't seen, I mean, it's extremely germane, your talk, because so many patients do have lung fibrosis after COVID, and given how important the power of the chest is to voice production, one would assume naively that it would impact upon singers and singing voice. We haven't seen that yet, but I was wondering if you had.
No, I share your observations with regard to pulmonary functions and everything that happens to lungs following this acquisition of this problem. But as I said before, even I have access to many different clinics, and we follow singers both through Conservatory of Music and also through my own and colleagues' clinics in California. We don't have good, reliable data to support what we see in sort of individual patients. And I hope actually that most of the singers who have had, and I have seen some who've been victimized by this problem, they are recovering, and they complain specifically to the duration. They think that they have a problem of maintaining long phrases, vocally long phrases, and these phrases are unstable. But I don't have real data on that. If I may take about 1 minute with regard to foreign languages, we have conducted pretty formal studies with friends in Finland, maybe 14, 15 years ago, looking at changes in voice, speaking voice, fundamental frequency and intensity when you speak language that is not familiar to you well. So if you speak Finnish and you're Finnish, that's, you have certain characteristics of your profile. But if you speak, for example, Mandarin, Chinese, being Finnish, something happens to your both intensity, duration, speed, and fundamental frequency. And typical pattern is that the further away from the language that you speak is from your native understanding, the pitch goes up and up and up and up. That's all.
I would like to thank you, Chris. Thank you, Yun. I would like to tell you about post-COVID and COVID. I do have many singers and actors that have had COVID in the different levels that we know. I usually ask all the regular blood tests and also lung tomography and spirometry. And they do have some problems, and we need to make rehabilitation. And they are complaining mainly, we are making now statistics about that, they are complaining, as Chris said, in sustaining, but also what I have noticed is that they don't have a very stable flexibility. That means when they are singing, the phrases, the tones are not properly intonate. That means that they don't have the flexibility to change tones. And I am talking about professional voice singers, opera singers. And this is very interesting because, for example, we have a slight edemas remaining from COVID-19 in the subglottal region. That means that how is the flexibility because of this subglottal region is with edema, they cannot make it properly. Another interesting things about breathing support and placing voice in these patients is that they have many times gut problems and reflux problems, but not because they have had before reflux problems, but because the post-COVID remains also with gut microbiome problems. I am going to talk about that in Philadelphia in 2nd June, because there are many studies now that are telling us that the proteins from parts of the coronavirus are remaining in the gut many months after they have already no problems with the acute sicknesses. So what I have seen these problems with lungs, with vocal folds, and also with gut and reflux because of this. Yes, Andrea, did you like to talk something about this interesting theme about the singers, and if you have seen some stroboscopies changing in these post-COVID patients? A little bit louder, or I don't know, your micro is... No.
Andrea,
yes.
Check your sound. You're not on the sound. Your microphone is mute. On the bottom left, the first icon that you see, there's a microphone.
When do you want to, now that Andrea is looking at the microphone, when do you want to? Yes, Andrea, sorry.
This is,
oh, yes.
I think this is the wrong microphone.
Oh.
Because it's not muted.
Yes.
Yeah, I don't think his microphone
okay, Andrea, I'll ask to Gwen Corbin. Dear Gwen, do you have some experience with this post-COVID sickness in artistic voice professional users?
I'm going to unmute myself now. Okay. Yes, I have. I'm finding the same things that a lot of people have said, that they're just having trouble maintaining phrases, that they seem to just not have as much of a volume or as much breath support. The other thing I was going to ask to the group is that I've actually seen 2 people who have developed vocal fold paresis almost immediately after getting their COVID vaccines. And I know one is a professional singer, the other one is not, but it was both within like a day or two of the vaccines. And of
Can you
interest, is
repeat
one of
what
them,
it is, what they developed immediately? Because
they developed a vocal cord paralysis
Oh.
immediately after the shot. And one of them said she was getting better. She wasn't back in between. And then as soon as she got the second dose, it got worse again. And I'm just wondering, that's another thing that I haven't really seen so much with the COVID illness, but I now know of two people who have had it after the vaccine. So I'm wondering if anybody's been seeing anything like that.
Hi, go ahead, John.
I heard about one case. I didn't see that case, but you know, these anecdotal or these very rare occurrences of post inoculation have to do with a lot of other factors. This is not just, and depends on what type of the vaccine people get, what is the pre-existing condition, blah, 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 blah. So
Yeah.
it's very difficult to say, hey, you know, if you get vaccinated, you get paralysis unilateral. Is it paralysis or is it paresis? Did you watch them yourself?
Yes, well, one of them I did, and she was getting a little better. As far as I know, we talked a little bit about ear stuff too. There's another thing that I'm seeing, which is a lot of people who have had a history of tinnitus, their tinnitus is definitely worsening after the shot. And then within a few weeks, in most cases, it's gone back to its baseline level. But I don't know about this with the vocal fold paralysis yet, because these were both pretty recent.
Yes,
So-
John?
Can I pick up on that for a moment? Can you hear me?
Yes.
I just reviewed a manuscript earlier today, and in the article that I reviewed, they quoted a paper that, of course, Bob Sedeloff, who else would write a paper, had put in Journal of Voice 2 or 3 months ago about post-COVID syndromes. And I haven't read his article, his manuscript, but their paper suggested that his manuscript was talking about post-COVID laryngeal palsies and paralyses. I think it came out sometime in 2021 in the last 2 or 3 months. So you may want to troll the literature and take a look.
Yeah,
Well,
thank you.
Thank you, John. So when I wanted to comment you also into the group that I have seen many patients with paralysis, but it's a temporary paralysis. Of course, I take in another group the patients who had intubation, because the patients who had intubation, they have a lot of deglutition, swallowing problems, and also voice problems, and also paresis problems. But I do have some patients from many years that they were perfect, and after COVID, they have paralysis. And about the vaccine, I have not noticed anything, only what everybody reports about headache and small fever and muscle ache and things like that, but not really laryngeal. But I think what I have had, unfortunately, are families who, let's say, 4 or 5 days before the vaccination, they were together, they got the coronavirus, and then they got the vaccine. And the day after the vaccine was the 5th days of the coronavirus presence. So it was not due to the vaccine, but to the coronavirus that they had 4 days before the vaccine. So they said, no, it is the vaccine. And I say, no, the vaccine is not making such a long inflammation, and the blood tests were completely terrible. But I have seen paresis and paralysis. I have seen both, but not from the vaccine. Yes, John?
Question to Gwen and John as well, and to Ilter. You know, look, people who I had been vaccinated with Moderna in February, and I had a post-second Moderna shot, I had a very difficult time with joints for about 3 days. So there are, larynx has, or glottis has joints, it's the synovial joints. So maybe it's not paralysis, but it's something that has to do with the synovial motion and lack of, and that just gives representation of joint rather than neural disconnection, because I mean, paralysis, it doesn't come and go like in magic. Paresis maybe does. So I think when we say paralysis without documentation that is really paralyzed, I think we are overusing the term and underestimating diagnosis. What do you guys think?
Yes, but as I said, I saw patients post-COVID, and when was asking about vaccines. I don't know, Johnny, if you have some comment.
I have to say I agree with Christoph here on that.
Thank you.
I think that people who have been intubated, all bets are off as to what's happened. And I also have had both vaccines and have had COVID myself. And there's no question that there's a constellation of symptoms that one can have. I'd like to pick up for a moment on Gwen's comment about tinnitus. And in the last 6 or 8 months, in my own practice, I have seen a huge increase of people with mental health issues. I don't know if other people have noted that too. And I mean, mental health issues are absolutely rampant. And we all know that mental health issues, one of the side effects is a worsening of tinnitus.
Yep.
So I think we all have to, we just all have to be so supportive generally and holistically for our patients. And
Yes.
I think I have a feeling that that's one of the key issues from the standpoint of this general milieu of concern and anxiety that's been surrounding this problem.
Yes, we have to make a special day session for this mental situation. I think it's important. And Ilter, do you want to answer Chris about the vaccines?
Yes.
But
so
can
I
you
have-
speak a bit louder?
Yes.
Or
Is it coming
nearer?
now?
Yes,
Here?
yes. Better.
So
Thank
yes,
you.
I have seen some patients and I followed them up for some months. First of all, I have never seen any or heard any paralysis case, but it's possible to for the perineural involvement because of some immune attacks of the body to itself, because of the virus, because of the materials in the vaccine. So it is okay, not impossible, but I haven't heard, I haven't seen any. And the cricoarytenoid involvement is coming to me more nearer than the neural involvement. And also there are, I do agree with John, the mental problems of the singers are very severe. One of them told me, yes, I'm just making a signature on the contract to sing, in the summer, but I'm not sure that I will be able to sing on stage. She's a singer since 25 years. So that's another issue. And also my experience about post-COVID singers, first, the muscles are not good. So we need to make a physical therapy or exercise on our patients. Second, yes, apogeo is not good because the lung capacity is diminished. So we need to work with high back pressure expiration and high back pressure inspiration exercises. But we will have good data maybe 2 years after this pandemics.
So please keep in mind the ideas that we are talking about, because I think we have to focus in a special session, as we have already said, reflux and COVID, because COVID has also problems in the arytenoid movements because of the vicinity of the neighborhood. And of course, there is a big problem with voice, also with paresis. And I don't know, Andrea, if you want to add some comments, what I asked you about stroboscopy. Oh, micro, Andrea. Oh, micro. No, we don't hear you. Oh, Alfonso Borragan is here. Great that you join us. Well, I wanted to ask Valentina about the question of post-COVID and breathing support. I don't know, Valentina, if you can tell us something about your experience in post-COVID patients, in artistic voice patients, of course.
Well, you hear me?
Yes, perfectly.
Okay. I can share my clinical experience during this 1.5 years. I've treated about 50 patients post-COVID from intensive care units. So the big problem for the elasticity of the rib cage, because you have to have in mind that bilateral interstitial pneumonia is a restrictive pathology. So it's related to many peripheral restrictions. So all the structures are very, very rigid. You have to rehabilitate the elasticity in the structures, in the rib cage and the spinal cord, and link the levels, so cervical to dorsal, and the passages, so cervical dorsal passage 371, and also in the larynx. It's primary to establish a good elasticity in the spine. It's primary then recondition the laryngeal elasticity and mobility.
Yes, I thank you very much, Valentina. Joseph, did you want to ask something, Joseph? This is good that you could come.
Yes. Sorry to come later because my daughter Johanna has had a presentation. She's an artist, and I have to go there. It's very, very important to go to my daughter. I have regarding the technique to make the videos and all the PowerPoints. I think we can learn a lot from Marco Frontini. That is a wonderful technique to present himself and present other information. And the problem is, I'm not a generation to learn all the modern, the standard now of the technique. I think we should, somebody should do a workshop with us to present, to produce such wonderful Zoom materials.
Okay.
And we should work on that.
Joseph, do you have some comment about your post-COVID patients, artistic patients?
Yes, not singers, but other persons. They have problem with their fitness. They have weakness.
Okay, Kevin.
They have weakness and
John, can you please
yes.
take your micro off, John? Your micro, please. Thank you. Yes, Joseph.
Okay.
Yes. Somebody wants to tell us about, for example, Orieta, do you want to tell us something about the post-COVID artistic patients, artistic voice patients?
Well, just a few ideas till now, because not yet instrumentally assessed or ordered. But first of all, I agree with John about stress, about fear. For instance, the fear to go back to the place where you think you got COVID. So if it's on stage, if it's on rehearsals room, you do not accept to go back in there and work in there. And some have problems with the breathing control, as Christoph so beautifully explained us. And even if they are accustomed to use their own body, they realize that it's not accomplishing with them anymore, or not as usual. This is something that make the artist not sure about himself, and so they have to learn. And I think that Ilter perspective to work with the actors and the reason about how to help them, and Valentina, and so we must have empathy, and as John has said, and understand how to cope with the problem, not only focusing on lesions, because they want to go back, not to think of lesion, but think of how to gain again my own career, my place. So it will be a challenging year, I think.
Yes, thank you very much, Orietta. Catherine, I wanted to ask you, Catherine Newman, first of all, to thank you very much for your presentation. Catherine, are you there? Catherine? Well, yes, Catherine. Yes, thank you. I enjoy very much your presentation, dear Catherine. And well, you have a great expertise in these hearing problems, noise induced because of noise entertainment. Which is your main experience, for example, not only in the singers, but also in orchestra directors or instrumentalists, about the hearing problem? Because some of them, they do not accept usually that they have hearing problems, because they do know there are a lot of artistic characteristics going to be lost. So which is your experience, Catherine? Can you please tell us?
Yes, this is crucial with hearing. It is called the hidden disease, but it's not only hidden for the others, it's often also hidden for the persons themselves. A long time, and this is one of the reasons why from the people who would need hearing aids, for instance, less than the half really uses hearing aids, and if they buy some, they often end up in not used. And hearing aids are anyhow a problem for musicians and in the orchestras. Orchestra players are more in danger of hearing loss than singers in general, because of the exposure, for example, the viola or flute in front of the brass instruments, and so it's well known that hearing loss counts an occupational disease for musicians. However, also people in choirs are in danger, and there have been examinations or studies which showed that soloists, even singers who stand in front of the orchestra or the choir, can wear ear protections for musicians without losing their power, without losing sound energy and changing the timbre. However, singers in choirs have the difficulty that they hear themselves relatively good, but others not. And so many of them refuse it, and also by other reasons, by stigma and so on. And so the only things you can do, then maybe the technique improves. It improves really good, because modern ear protections and hearing aids use acoustic scene analysis, which goes very fast, nearly on time, and regulates the outside sound down. very quickly, within milliseconds. Even for hunters, even before the bang comes, the ear protection regulates the sound down so that it doesn't hurt or injure the hearing. And what you can do is make sound level measurements. You can do it with an app nowadays, as it has been shown in one of the presentations. I guess it was
Linda.
Linda, it was Linda. Yeah, and somebody should have a look for the sound, for the room acoustics. And if it cannot be avoided, that very loud sounds, in particular impulse sound, peaks sounds, they are very dangerous. If they cannot be avoided in a piece, then it has to be made clear that you need enough breaks. So not longer than 8 hours, having enough breaks. And what I said, it should be also made clear that the repertoire or the program should not have only very loud pieces played or sung, but change it. Yeah, and what is also very important is the awareness for the injury which can happen at WHO. We just wrote the World Report on Hearing with many, you can download it from the website of the WHO, and it's fantastic. You can read everything about age-related hearing loss, risks for hearing loss, what you can do to prevent it, and so on. I forgot what I wanted to say about WHO. Oh yeah, I know. There is an increase in prevalence of hearing loss at all due to aging of the population in particular, but also to laser noise, to really have these insertion phones which do not let sound going out. And if you have impulse noise, then this is dangerous. Or sitting in a car in a closed, small room and having this loud bangs which go over the motor sound noise, that is really dangerous.
Yes, the great problem is the regulation of the laws regarding the noise-induced entertainment noise, because there are many problems also with the inner ears and things like that. And do you have some experience with ear protectors, especially for singers? Because I know in Germany that there is a brand, and I think this is a good thing if we try them. I have told them to my patients, to the singers, if they are going to be in very loud atmospheres, but they are very afraid that they cannot have the correct biofeedback with these protection ears. I don't know, what is your opinion, Catherine?
I have to say, I had once inner ear hearing loss after a toxic hearing loss after otitis media. And it was not much, 30, 40 decibel, and I came up slowly within weeks and months again to normal hearing. However, I tried in this time to play in a string quartet, and I felt so insecure because you have this non-linearity in the inner ear functioning. I didn't know any longer what is my sound, what is my tone. Am I out of tune? Am I too loud? And so many, there are so many singers and musicians who feel slowly, gradually come into this situation. I know some good sound protecting hearing aids or sound protections from Neurot in Joseph might know them from Austria. But if people are interested in that, I can find it out some very good brands and recommend it, write it to you, and you can just
Yes,
send
thank
it
you.
out.
Thank you. Thank you, dear Catherine. And Petra, you wanted to ask something?
Can you hear me now?
Oh, yes.
Yes.
Peter.
Yes.
Let's hear Andrea. Thank you, Andrea. But speak louder, please.
Okay. I had some problems with the connection. I apologize. Of course, with the stroboscopy, you can see some problems about the mucosal wave. Only with the stroboscopy and also with high-speed video endoscopy, you can see the mucosal wave. And in these cases, you can see problems, especially in this type of production. I have a short comment regarding the presentation of Isabel Garcia Lopez regarding the speaking voice. Just a short comment. It was very interesting because it shows the difference between the speaking voice when the patient.
Oh, you went away.
The days of the week, and the reading voice. During the reading voice, the production is different, is better, and the problems comes with the speaking voice. So it's very interesting, the difference between the speaking voice and the reading voice. Many compliments. Just a short comment about it.
And Andrea,
Thank you.
your experience in post-COVID patients with stroboscopy, or your clinical experience in these post-COVID patients?
In post-COVID patient, I have little experience because in post-COVID patient, the people come for problems of the voice for intubation. But the problems for the intubation are more in the breathing problems and the more serious problems than the voice. But usually the problem of the intubation is when the patient had an intubation, too long intubation, and not only for the tracheostomy. So the problem I believe that stroboscopy can help the clinician in seeing the mucosal wave. And you can see if there are problems of the mucosal wave caused by the intubation or by the edema. As you told just before, you can see some edema, especially in the lower part of the larynx.
Thank you, Andrea. Yes, Peter?
Thank you. I wanted to add something. Can you hear me?
Yes, perfectly.
Yeah? Okay. Okay, I wanted to add something about the topic for the actors and singers after COVID, when they didn't suffer from COVID. So after the long period of time of shutdown in the cultural life. Last week in Germany, for example, so there's a reanimation of the cultural life. So many theaters open and also the stages. And many singers are untrained, so they are not used to sing in this situation, and also they felt the first time that they had stage fever for the first time in their life. This was the longest time for them to not to sing. 1 year we had like a shutdown in cultural life in Germany. And so it's more a mental problem also after pandemic, I want to say.
Yes, thank you, Peter. I think we have already 3 different proposals. One proposal is a session about COVID and the effects on the voice. The other proposal proposal from Orieta and John is talk about the psychological aspects. And the other proposals is about reflux and good microbiome. Yes, when
well, the thing I was going to say is I think that we were only like hit the tip of what's going to be a huge amount of problems that nobody's returned to Broadway yet. So as you're saying, the psychological effects of not having performed, plus a lot of the patients who have had COVID that will be starting to rehearse again, start back with their voice teachers, where I think that we may want to wait a little bit, because I think as time goes on, we're going to know about more and more of the post-COVID problems that we're going to see, whether it's from the infection itself or just the effects of the pandemic as well on us.
Yes, Gwen, thank you very much. I don't know, Bill, are you there? Bill Riley? Bill, hello, are you there? Did you hear me? Or are you driving? I think you are driving. Okay, so Alfonso, please.
Thank you, Eugenia. I don't see any patient with paresthesia or paralysis post-COVID, but I see in many patients that has a throat, a pain in the throat, not very intensive, but continuously, and it's very difficult for me to treat or to resolve this problem. I don't know if you see this problem also, or it's only a thing in the Cantabria.
Yeah, no. I have seen all these problems, and I do think also that's why I'm going to present the paper about food intake and microbiome, that the COVID patients had taken so many medicines, and also they are with a big stress, like we know. So that means that the reflux problems are great, and we cannot forget that the reflux symptoms, sometimes they are not from the stomach, but they are only in the larynx, and of course in the pharynx with pain. I have seen many of these patients. And another thing that I wanted to tell you, that I have seen since May last year, that many post-COVID have tinnitus, and they have also dizziness problems. So we have to talk about that and to read more about that. Otherwise, we miss some interesting issues. But sometimes this paresthesia is also mixed with the reflux signs. That means that the erythroid are not properly moving, and also the big edema, and everything is very red. And they were not intubated, but as I said, they have many medicines.
Maybe
Yes.
this is also due to the coughing. So by increasing the intra-abdominal pressure, you also get more reflux, of course.
Yes. Of course, the stories, the clinical history are different, and then we have to think about that. But what I know, and I explain all the time to the patients, that if you are having a lot of medicines like dexamethasone, enoxaparin, aspirin, or whatever anticoagulant you have to try to protect your stomach and to have some probiotics in order not to harm so much the gut microbiome. Yes, Isabel.
I want to add that what Alfonso says. He says he sees a lot of singers with pain throat. I also have seen many singers with pain throat, with odinophonia, and I think that perhaps this is related with Peter Hullin says that many singers that were used to sing every day, every week, now they have been not performing from several months. And now they are coming back to perform, and when they start to sing, they are not fit, and they feel this kind of symptoms. They have, perhaps they don't have lesions, but they have this odinophonia and pain that perhaps is related with this stopping in performing. I think this we will see more and more singers with this problem in these next months.
Yes. I remind you that in 2nd June, Ron Scherer and and one of his doctoral students are going to present a very interesting work about face masks. I don't know, Ron, if you want to comment something about this, what we are commenting, or about your work. Comment.
Sure. So the 30-second rather than 5-minute summary is that face masks we studied 3 of them. They're all low pass filters so that higher frequencies are attenuated more. And the N95 mask attenuates more than surgical mask and a singer's mask. And so it's reasonable to assume that the masks are the villain relative to much of the muffled sounds you hear people speaking. And the question, what'd you say? And speaking louder, and then also having other symptoms of muscle use and things like that. So yeah, this is a nice little study by one of our nice undergraduate students, honors project, and it's about the the low pass filtering aspects of these masks.
Supported by the hearing aids companies.
Yeah, we have $5 billion to do a study with 1 subject and 3 masks.
Okay.
This is great.
No,
Also,
no,
another.
that's a good point, though.
Yes.
And in America, as you know, we just lifted, I guess, wearing masks, but it's a good point because I don't think people are going to stop wearing masks, especially if they're in the OR.
Well, we didn't lift masks everywhere. We lifted masks outside, not in the conservatories, for example, not on public transportation, airplanes, buses, trains, etc. And in shops. Shops require, because we know we have 50 states, every state has a different law and different obligations and different restrictions. So yes, masks are not necessary now for those who are vaccinated and want to feel free of show the recognition of facial features, but it's not.
Well, but dear Chris, it depends where are you living, because for example, in Mexico, we need the mask all the time, because the activity of coronavirus is very high, and we are 128 million persons in the Republic, and we have until now 28 million vaccines. Of course, we have to take away the young persons and the children, but anyway, we need more vaccines, and we are very close in the big cities. In the big city, we are 28 million in Mexico City, so we need to wear masks. And another thing I wanted to tell you, because of this connection between the voice problems, the pain throat, and of course the use of mask, even though you are not singing or having rehearsal or concert with mask, you have been using mask. For example, in our milieu, we are using mask, and we are having the joint temporomandibular, we are having like this. We are having a lot of bruxism also. And so there are many special issues coming back the singers and actors to be on the stage. So it's not so easy.
It's an interesting point, Eugenia, because most singers that I know who use singers' masks, they complain about pressure on, specifically in male, pressure on the Adam's, what they call Adam's apple, because the masks are elongated and kind of a strange feeling. I have to go. Thank you very much for everybody. Just want to remind that I will send to all of you, with permission of our boss here, information about upcoming 29th Annual Pacific Voice Conference, and we will focus.
Next year, please, next year. We have to talk about times.
No, we'll do it this year, for Eugenia. If
no,
you don't,
this year is not.
No, I already moved it from last year.
CoMeT fatigue.
No, that's fine. That's
okay. Yes. Somebody wants to tell something, but I really thank you, because I think these experiences that we have had in our CoMeT sessions are really a big enrichment to our knowledge, and to see each other and to talk about the different experiences. So we are having now 3 different sessions, but of course, first we are going to be in Philadelphia with our dear Bob and his group and our dear friends from Voice Foundation. And then we are going to be with John Rubin and Ruth Epstein, and Craig Lee lives in the Congress in September. And then we shall decide, please think about that, if we keep on having monthly sessions or bi-monthly sessions or whatever you wish. This is a collegium and we all decide. So I thank you very much. Mauro, Fiusa, Carmen, Enrique, La Madrid, Norma, thank you for being with us. And I shall send to the CoMeT members, as our bylaw says, all the curriculums and photos from our proposals for new members 2021. I thank you very much, and please keep safe. And I send you many kisses from Mexico to everybody. And thank you very much.